Hello, my name is Dr. Agnes Ngassa. I am the Associate Specialist in Emergency Medicine at Hillingdon Hospital. And we are delighted to have with us Dr. Jocelyn Brittliff. She is the current chair of EMSAS. Hello.
Good morning. Apologies, I have a slightly croaky voice this morning. Hopefully it will last all the way through.
God bless. Thanks for joining us today. We're really delighted to have you here. So how's it been coming all the way from Scotland?
Yeah, so I've actually managed to cram quite a lot into one very busy visit to London with meetings yesterday and then this interview today, and straightforward travel despite the tube strikes. So.
Quite busy.
Yeah.
Okay. So I'd like to start by asking you, Jocelyn, if you could tell us a little bit about your background and what actually drew you into emergency medicine.
Yeah, thank you. So I decided when I was quite young I wanted to be a doctor, but I'm from a non-medical background, so I hadn't really thought much past that until I actually got into medical school and training, and I really enjoyed my stint in A&E as it was then, and like the variety and the difference, and did a few jobs in different specialities and realised that that was my home. That was what I enjoyed, the unpredictability, not knowing what's going to come next. And then within that, quickly realised that the SAS role was one that I've fitted in quite comfortably. I've been doing it a long time. Emergency medicine has changed hugely in that time. There wasn't a college of emergency medicine when I started, but it's been a very good fit for me.
All right. And you became the EMSAS Chair in December 2024, is that right?
Yeah.
Okay. And that was following Dr. Imad Qureshi's resignation. How was that transition for you, and what has been the experience?
So it was a bit of a whirlwind. I was very sad that Imad stood down, but I'd take this opportunity to thank him for everything he did for EMSAS, both before and during his tenure as chair, and he continues to do things that support the SAS Doctors. So it was a bit of a whirlwind. I was very honoured to be asked to take over and very grateful for the support of the rest of the executive committee of EMSAS, without whom I couldn't do this job, and the support of other people within the college as well. And I've been enjoying it so far. It gives you some opportunities that you don't expect to get.
Yeah. So since you became the chair, what have been like the main updates of achievement within EMSAS?
So the thing we're most proud of has to be that we've got our EMSAS Handbook completed, which is a project that Imad started. And again, I need to thank everybody that worked on that, both from within EMSAS that wrote chapters, the team at the college that helped us edit it and produce it professionally, and that is available online, and that is a huge achievement.
Okay. So how is EMSAS working right now to make sure SAS Doctors' voice are heard within the Royal College of Emergency Medicine?
I'm striving to make sure that we have representatives on all the relevant committees that are active and attending their meetings. Every opportunity that I get invited, if I want to have an EMSAS rep on a group, then we make sure we're there, and we've got a good team that do that, and link in with Gordon Miles, the CEO, regularly, with Adrian and Higgy, to know what's going on in the college and to pick up on any issues we may have.
Okay. Have you noticed any changes in the way SAS Doctors are engaging with EMSAS over the past year?
I think engagement is always a challenge. I would like to improve it, but I think that's an ongoing theme, and how do you get that? And the only thing I can ask is that everybody who comes across EMSAS or is a member of EMSAS who knows anybody else who's working in these roles within emergency medicine spreads the word within their hospitals, within their regions, to their friends. I work on trying to make sure that there's a little bit in the newsletter every time it goes out that's relevant to our SAS cohort, and all we can do is just keep doing things like this and getting the voice out there and hoping that people pick up on it.
Sure. Okay, so how do you see EMSAS strengthening support for SAS Doctors, especially around career development and recognition?
I mean, I think we just have to keep showing and proving what we can do, taking all of the opportunities that are handed out to us. The handbook is good sections on career progression and things that you can do, and encouraging people to develop portfolio careers as well, and the other opportunities that are available to them. We're working on extending roles that have traditionally been seen as consultant ones within the college, to have a look and see how many of those it's appropriate to open up to SAS Doctors. And also the Careers Committee have invited Michelle and Aileen, who are our reps with them, to work on some criteria that can be recorded to say you're working at a specialist level. So that's something we're probably going to have a small group within the exec committee to start working on shortly.
Okay. So, the conference is coming up in November, the EMSAS Conference. So, could you share a bit of insight or any specific themes or any specific speakers that you would like to?
Yeah, so the conference team have been great. They're well ahead of previous conference teams in their organisation. Sarah and Alina have done a great job. There are some sessions on silver trauma, there's one on medical cannabis use, there is some paediatric sessions, and we have got updates from various people within the college. So Higgy will be there to give a presidential address. I will be giving an update from the chair role. Dania, who is the lead on the portfolio pathway within the college, will be there again, and Gordon Miles, the CEO, is also going to come and do a talk. Okay. So it's looking to be a very good event.
So for our SAS doctors listening right now, so what do you think that they will gain from attending the conference?
I mean, I think it's a great event, and the team work really hard. It's meeting people, that's talking to your colleagues and counterparts from throughout the UK to see what they do and pick up tips and meet people. I really enjoy going to the conference every year and catching up with people that I now think of as friends that I've maybe not seen since the conference last year, but there's a core group that go fairly regularly, and it's a nice environment. It's just a somewhat smaller conference than some of the big ones, but it's a lovely environment.
Okay. Jocelyn, we're going to talk about something now. So many of our viewers may not be familiar with the term tier capability, sorry. So could you briefly explain what it means in the context of emergency medicine, and then give us a short update on where things stand and how EMSAS is engaging with it?
Okay, so the tiers document that was produced by the college initially a few years ago, and was revised at the end of last year, beginning of this, looks at where people should be working, and it's about entrustment levels. So it starts at 1 and goes up to 5. So tier 1 would be F1 level, where everything they're doing is needed very heavily supervised, and the level of supervision required goes down as the tier goes up. So to align it to kind of training posts and doctors, by the time you're tier 3, that would be RCEM credentialed ACPs, your ST3 level trainees, and perhaps more junior SAS level doctors. Tier 4 is your senior trainees, and tier 5 is your CCT holders in emergency medicine.
Right.
There was discussion around where the more senior speciality doctors went, and that was an active discussion, because I know a lot of our members were very disappointed that we are not listed as being capable to do tier 5. And I just want to reassure them that that was an active discussion. I had the chance to discuss it with both Higgy and with Adrian prior to council, and it was discussed at council, and the council vote was tier 4. However, it is a guidance document, and we did also make sure there was a clause that covers the fact that we are very well aware that there are people working at tier 5, and that they are being continued to support at tier 5.
Right. So since this interview is part of the SAS week, so what does that mean to you personally, and why is it important for SAS doctors?
I think it's really good that they have SAS week. I think there are so many people, even within the medical world, that don't really appreciate what SAS doctors are, what we all stand for, and when you get out into the public, it gets even harder to try and explain where our role is. But I think we're a vital part of the NHS and in emergency medicine. There are a lot of departments that are heavily reliant on their SAS doctors, and it's really nice to have a week where we can stand up, we can publicise who we are, we can say what we're about, what we're doing, and showcase our skills not only within our departments, but perhaps some portfolio careers, and get a bit of recognition and feedback on what we're doing. So it's just lovely to spread that word.
Okay. So finally, what excites you or motivates you to work with EMSAS? And
I mean, I consider it a privilege to be able to do this. The new opportunities, the chance to network and people, but also I am so positive about being able to change things for the people that are coming behind me and SAS careers, and open up opportunities for them potentially that I didn't have, and that increased recognition, especially that things like the new contract have brought in, and just be out there and showing what we can do.
Okay, so the future for SAS Doctor within emergency medicine?
I think it's very bright.
Okay, so we've come to the end of this interview. Thank you, Jocelyn, for accepting to come. Thank you for your time. And thank you, viewers, for listening to us. I would like to say a special thank you to a few people. We've got people working behind the scene, as you would have imagined. So I would say thank you to Ashley Yates, who's a senior media and communication officer at the RCEM. I'd like to say thank you to Lawrence Durr from the digital team. Also, thank you to our videographer, able videographer, Elliot Fogel from, let me get it right, from Legoff, sorry, yes. And to our tireless Dr. Paul Besner, who's very active behind the scene. Thank you very much, Paul. And Paul is the EMSAS London rep. Thank you, everyone.